If your child is experiencing a relapse or you're concerned about the potential of relapse, it's important to stay calm and communicate effectively. This can be difficult in the heat of the moment. In this video, we'll discuss strategies for communicating with your child about relapse. We'll also discuss how to respond effectively to a relapse. Let's start with communication. It's important to try your best to be empathetic and non-confrontational with your child. When your child relapses, you might feel scared and inclined to respond with anger. But because anger is more often destructive than helpful, I encourage you to sit down with your child and listen carefully to what's been going on in your child's life. Keep in mind that your child is likely using substances for a particular reason. Maybe they're feeling depressed. Maybe they've experienced trauma. Maybe they're being bullied. Maybe they started hanging out with other people who are using substances. Knowing what's triggering their use can help you steer your child back on course. That's why it's critical to create a safe space for them to communicate honestly with you. I understand that this is all easier said than done. The more you can remain patient and forgiving, the more you'll be able to help. Your child is learning to manage their substance use disorder. Your family is adjusting to the ongoing recovery process, which often includes relapse. Remember, this isn't you against your child. It's you and your child against the disease of addiction. That said, you still need to maintain appropriate boundaries. In fact, communicating your expectations, setting clear boundaries about acceptable behavior, and holding your child accountable can all be accomplished while maintaining a safe space for your child to communicate with you. Keep in mind that if your child has had a relapse, they may lie and deny substance use. Professional support can help you navigate these conversations and get to the truth so you can better help your child. It's important to be open to the professional suggestions. As an addiction psychiatrist, the hardest part of my job is when parents are reluctant to take action. As a doctor, I recommend that parents try their best to listen to the experts and be open about the treatment recommendations. Getting an appropriate level of care will lead to the best outcomes. I can understand from a parent's point of view that you need to advocate for your child's best interests, and it can be hard to trust others to do the same. I can't encourage you enough to listen to what's being offered. The change you may not want to make is often exactly what your child needs the most. When it comes to responding to relapse, the big picture is this. Your child is looking to feel understood, respected, and loved. They're also looking to you for guidance, clear boundaries, and expectations. Do your best to communicate in a way that lets your child know you care and that you will support them.